Bismillah, salam ala Rasulillah. Ladies and gentlemen, I would like to introduce myself to you. I am Dr. Leila Awad Sid Ahmed, consultant internal medicine and assistant professor at Rayyan. I'm quite delighted to introduce to you bacterial infections. والحمد لله على سلامتكم جميعا. نحمد الله على السلامة وربنا يحفظكم من كل سوء. In this era of COVID-19, I'll be giving you the most common bacterial infections, and we are trying our best to make it as short as possible. Bearing in mind we are in the era of COVID-19, and we are trying our best to make things easier for you. I have really chosen the most important things that you need to know and the most important things that you need to do while dealing with patients in your real practice. So the commonest bacterial infections in man include tuberculosis, brucellosis, acute bacterial diarrheas like shigellosis, and that's why we have just chosen the commonest for you. I would be starting by tuberculosis. So what's tuberculosis? Tuberculosis is a chronic disease that affected man since the ancient times of the Romans, the Egyptians, and till today we couldn't get rid of it. In early 70s, the incidence has been reduced, but then it came up again in the 80s when the HIV infection was discovered, because it tends to affect immunosuppressed patients as well as immunocompetent patients as well. So what is this disease? Tuberculosis is a common disease worldwide, and it is caused by genus Mycobacterium, which has got many species. The most important of them all is Mycobacterium tuberculosis. There is also Mycobacterium leprae, which causes a disease known as leprosy. And we are now concerned about this Mycobacterium tuberculosis. It primarily affects the lungs. And it's an acid-fast bacilli, it's a bacillus, and strictly aerobic. And this would explain why it mainly affects the lungs. Although it could be disseminated, and in immunocompromised patients, every system of the body could be affected, but it mainly affects the lungs of man because of the good amount of oxygenation that are present in the lungs. Tuberculosis could be an overt disease or symptomatic. Patients might be symptomatic, or the patients might be asymptomatic, and this is known as latent tuberculosis. So what's the difference between latent tuberculosis and active tuberculosis? We are going to discuss in a minute. The epidemiology of this disease in 2017, the prevalence of the disease was found to affect actually the incidence, that's the new cases per year, were found to be 10 millions. And 1.6 million of people used to die annually. So in Africa, Southeast Asia, the incidence is quite high, and it contributes to around 70% of the global prevalence of tuberculosis. In patients who are immunocompromised, like HIV cases, the disease would be flourished and florid, and it's going to be disseminated, that's to say all over the body, and it affects the lungs as well as the gastrointestinal tract. It affects the bones, the brain, everywhere in their bodies, as their immune system is quite knocked down by the virus. And that's why the disease contributes to a high morbidity and mortality particularly in HIV patients. Since the introduction of the heart treatment for HIV, then the incidence of tuberculosis also has gone down. So what's the difference? Before we discuss the clinical features, I would be very much interested in discussing the difference between active disease and latent disease. The active disease means the patient is symptomatic. He's complaining of fever, cough, weight loss, night sweats. He might have sputum with the cough, which might be bloody, that's hemoptysis. He might have chest pain due to pleurisy, and pleuritic chest pain, as you all know, would be sharp, well localized, and it would be increased by breathing or coughing. So this is very characteristic of pleuritic chest pain, which could be due to tuberculosis or even simple pneumonia. What else? Fatigability, loss of appetite are all features of the disease. What about the latent? The latent, the patient doesn't display any clinical features and he's quite asymptomatic. The disease cannot be transmitted from a latent patient unless he is immunocompromised and then he converts to an active disease. And this is why we would like to get rid also of the latent, because at one time in their life they might be immunosuppressed by the disease or a treatment, then they would start to be active cases and spread the infection as well. In this slide, you are going to look, if you look carefully, it shows that tuberculosis can affect anywhere in the body. But commonly the lungs, where it can lead to pneumonia, pleural effusion, chronic cough with sputum, and this is by far the commonest presentation, is the cough and the fever, and the fever is usually of low grade, accompanied with night sweats. There are multiple organs that could be affected by tuberculosis, like the brain. They could be having meningitis, the renal system, the kidneys might be affected, leading to sterile pyuria, and almost any place in the body could be affected. Tuberculosis is known as the great mimicking disease. That's to say, it can simulate many diseases. And hence, you have to consider them in the differential diagnosis of almost every complaint, particularly in endemic areas, of course. So in Saudi Arabia, it's endemic, and I was planning to get you the incidence and the prevalence in Saudi Arabia, but I would just send it to you as an email. What about the clinical features in pulmonary tuberculosis? In addition to the features that we have just mentioned, then on clinical examination you would find abnormal breath sounds, you might find bronchial breathing, you might find rales, that's to say crepitations, and usually features of consolidation. You might find features of cavitation, which would be increased resonance and bronchial breathing. In addition, you might have features of pleural effusion, which would be dullness to percussion and reduced or even absent breath sounds. And you might find bronchial breathing at the top of the pleural effusion. This is all very important. And on this X-ray, there are multiple cavitary lesions. It's rarely that you would see this, and probably this patient is immunocompromised. So what about the extrapulmonary manifestations? As we have mentioned, the patient might present with confusion, meningeal signs, neurological deficits, neck pain, neck stiffness, and he might have choroidal retinitis.